A very warm welcome to all of you friends and a warm welcome especially to our chief guest, the Honorable Minister of Public Health, Government of Maharashtra, Shri Shetty. When I went to meet him at Mantralaya a week ago to request him to inaugurate the seminar, it took just a few nanoseconds for him to agree. He read our letter of invitation and said that this is a very important subject, and the Honorable Chief Minister had discussed the matter in the Cabinet and asked him to take the necessary initiatives, such as contacting TISS and asking TISS to recommend steps that the government of Maharashtra should take, the corporation should take, and he welcomed the initiative taken by the Observer Research Foundation. So, a very warm welcome to you once again, Dr. Shetty. We are also expecting late in the evening Srimati Manisha Maiskar, who is the Additional Commissioner, Municipal Commissioner in charge of Public Health. We are pleased to have two eminent specialists, Dr. Shubhangi Parker of KEM Hospital, Dr. K.T. Gandevia from TISS. We have truly a representative assembly here, practitioners, medical practitioners, representatives of helplines such as Samaritans, our young friends from Yuva, Art of Living, eminent doctors such as Dr. Sudha Bhave, friends and faculty from IIT Bombay, and of course, friends from the media. Why this seminar? Before I answer this question, just a few words about the ORF, because that goes to answer the question. The Observer Research Foundation is a public policy think tank. It has been in existence for over 20 years in Delhi. It has had several functions even in Mumbai, but we have started our activities in an institutionalized way only recently after moving to this office. And we have identified public health as a very important area of engagement, along with education, along with urban renewal, inclusive development, protection of our artistic and cultural heritage. Public health is an important area for ORF. About a month ago, we had arranged a talk here by Dr. Meera Narasimhan, a well-known personality from the field of mental health from the University of South Carolina. She gave a talk here, and she said that mental health is going to be a major global public health crisis. Something that we have only now begun to realize, if I can say so, because we have not paid much attention to it. In all of India, of more than 1 billion people, we have only 4,000 specialists in psychiatry. Our institutional care for mental illnesses is quite inadequate, and especially for preventing suicides. And just at the time that we were having this talk, the media were reporting cases of suicide, including suicides by students. So we felt that we should organize an event here and bring together medical practitioners, academics, activists from NGOs, and collectively discuss what we can do together. And therefore, when I went to invite the minister, he asked me, what is the purpose of the seminar? I said, one takeaway from this seminar is that we would request you to set up some kind of a permanent institutional body, something like the Maharashtra Council for Prevention of Suicides, which brings together medical practitioners, NGOs, academics, representatives of the administration, to see how this can be prevented. We may not be able to prevent every single case, most certainly, yet we have an obligation to minimize, and it indeed can be minimized. I must introduce here two colleagues of mine who helped ORF organize this seminar. They are the two resource persons, Shri Ketan Khanna. Hi. When I met him, I was truly moved by knowing that he has actually worked for 4 years as a volunteer with Samaritans, the helpline, to help suicidals. We also have Maulik Mawani,
Namaskar.
a young activist who also is working at the grassroots, helping mentally challenged children. And they together, along with Varsha Raj, please, from ORF, they have put together this very useful, informative discussion paper for the seminar. Before I end my opening remarks, friends, I want to quote a few powerful lines from Dr. K. Redfield Jamieson from the Johns Hopkins University, someone who suffered from acute mental depression herself and even attempted suicide, but she overcame her condition and wrote 2 very powerful books, including an autobiography which is called An Unquiet Mind. And in this book she writes, the suffering of the suicidal is private and inexpressible, leaving family members, friends and colleagues to deal with an almost unfathomable kind of loss as well as guilt. We all build, she says, internal sea walls to keep at bay the sadnesses of life and the often overwhelming forces within our minds. In whatever way we do this, through love, work, family, faith, friends, denial, alcohol, drugs, or medication, we build these walls stone by stone over a lifetime. Friends, it's better, in my view, to build these walls not with the stones of denial, loneliness, but walls of love, work, family, friends, and faith, and initiatives like this.